Good morning. This is Dr. Timothy Scott Beck here at LifePoint Medical, and we are open. It is the 27th of August of 2021, and I want to reiterate to you, if you need something, we want to hear from you. I've got the weekend crew, which is Dr. Woody and Dr. John, our PA. They're working today so that I can get other stuff done. So I appreciate you being cooperative with that, and they're here for you. And if you got something, if you think something's brewing up for the weekend, come on and let's get you seen and get you taken care of so you don't go into the weekend needing help. So let's talk about the COVID-19. 1,728 cases this morning. That's up. We know it's around here. We already have a line outside the door wanting rapid testing, and tell your friends we've got that for people. It's $80 and instant results, and we give you a sheet to verify whether you're positive or negative. They just have to pull up here to the line around the building and give us a call, and we'll handle everything over the telephone, and then we'll go out there and test them. And I want to remind everybody that we do have protocols set up for people who are positive, but I do want to talk to you about one thing. I've been prescribing ivermectin for the COVID-19, and a lot of people have been contacting me from across the state asking me if I'm prescribing this medicine. And I said yes, and I've done a pretty good bit of reading on it, and I feel like it's been doing us well here. However, the pharmacies talked to us yesterday. At least 2 pharmacies in this community called me and said, we will no longer be honoring your prescription for ivermectin. We won't be giving it to you anymore. And we asked why, and they said that there was a shortage. Now, I'm not sure what's going on there. That has never happened to me in my career, where the pharmacist calls you and says, we're not going to be doing that no more for you. Okay, so I'm not going to be prescribing ivermectin from now on. I'll do the azithromycin. And if you're at high risk, we're going to get you the IV monoclonal antibody infusions over at the hospital. Okay, and those are supposed to be free to anyone. So I'm not sure what's going on there. I'm sure it's a political thing or something, and I know it's controversial. I do know that I feel like we've handled our COVID patients well over the last few weeks, as good as we could, giving them options and giving them solutions to their issues. However, again, this is out of my reach with whatever's going on. So, but we still want to hear from you, and we still want to intervene if we can. On the flip side of that, if you're a vulnerable patient, I don't want you out in the community this weekend, okay? And I want to talk about vulnerable patients, okay, because the word on the street is younger patients are dying right now, 30s, 40s year old patients. And I had a friend of mine from Florida tell me that that's the dominant age group right now that's been hospitalized. And there's 2 things about those folks. Number one, they're not vaccinated and they're obese. Okay, so everybody wants my opinion on vaccinations and the disease and what you should and shouldn't do. Okay, if you are morbidly obese, okay, that means if you're 50, 100 pounds overweight and you're in those age range and you're not vaccinated, I feel like you're at imminent danger. Okay, and that's my opinion. I feel I'm scared for you, okay, because I know that that's the perfect storm, okay. If you're obese and you haven't been vaccinated and you get exposed to this, I know that it's very difficult to keep you from getting really sick and dying. So please, if you fit in that category, okay, you absolutely have to social distance and have to stay out of harm's way. If you're in that category and you want to play it safe, I do think the vaccine is legitimate for you, okay? And the risk of not getting it outweigh the benefits of not getting it, or vice versa. The benefits of getting it outweigh the risk of not getting it, okay? Now, again, I usually take people on an individual basis, and that's always what I'm going to do in the exam room. So if you need an individual assessment, the weekend crew or me can give you that if you'd like to have an appointment to discuss it. Okay. Other than that, I heard several people, like 15 people have told me over the last few days that, hey, we're worried about you. You're working so hard. We're afraid we're gonna lose you, or we're gonna burn you out. But I want to tell you something. I'm doing exactly what I asked to do. I am so blessed, and I pray for this what I do right now. It's exactly what I want to do. And yes, I do work hard, and I've got 2 or 3 things that I do, okay? But I think I would be miserable if I didn't have all the things that I've been blessed with right now. So don't worry about me. Actually, use me to keep you out of trouble, and we're on the same page with that. And I do look after my own personal health, and I look after my family health. In other words, I spend time with my family, and they know, okay? But I also work very hard to, like this weekend, I'm gonna do what I need to do to get ready, so Monday I'm fresh and clean and ready to go, okay? So thank you for your concern, and I'm gonna keep working hard, and you keep using me to keep yourself out of trouble. Please give us a call if you need it. Have a wonderful day. Thank you.